Thank you very much for joining the second of the Global Health Advocacy Incubator Food Policy Program 2021's Global Advocacy webinar. In this case, the SSB Taxes Part 2, which will focus on legal and communications best practices. In this session, advocates from the Caribbean, Brazil, and Mexico will discuss how to prepare for possible legal challenges to SSB taxes and fighting for opposition attacks through effective narratives. We will start with Brazil. We know that most countries are working on SSB taxes, advocacy campaigns, and we also know that this topic can be challenging from a communication perspective. We are thrilled about the first presentation from our Brazil partners to share some of the highlights from their communication efforts last year to make the case for an SSB tax in Brazil. I'll introduce the two panelists for this first presentation, and then I'll introduce the rest of the panelists just before they are speaking. So in the case of this presentation, Marilia, who's an Innovation and Strategy Coordinator, and Daniela Guedes, Director of Campaign and Mobilization at ACT, they will share highlights and lessons learned from their most recent SSB tax communication in Brazil. ACT use economic data and messages to explain how SSB taxes are good for health and for the economy. Marilia and Daniela will share more details about their campaign and the lessons learned. Marilia is a graduate from the Federal University of Sergipe with a postgraduate degree in marketing from the Escola Superior de Propaganda y Marketing, MBA in International Trade from FIA, and specialization in advocacy and public policies from FGV. She has experience in innovation, market intelligence, and strategy, having worked in the private sector and as business consultant with social impact. Daniela is a journalist and graduate of Faculdade da Cidade do Rio de Janeiro with an MBA in marketing from Escola Superior de Propaganda y Marketing. Daniela has broad experience in the field of business communication and marketing, having worked in advertising agencies, communication firms, and communication and marketing departments of public and private companies. Last year, Daniela was the recipient of the Judy Winkelfer Award for International Excellence in Tobacco Control, given by the Campaign for Tobacco-Free Kids. Before the presentation, we'll be doing a quick poll just to get some of your ideas on some of the things that we'll be discussing. And this is in particular something that will be addressed by Marilia and Daniela during their presentation. You can now, you can see some of the options there. What are the main arguments against SSB taxes you face in your country? So you get to choose some of those arguments opposing SSB taxes in your countries. And we'll see the results soon. These are some of the common arguments that we face. So just checking what are the ones that are more relevant in your own countries. Okay, thank you. So we see there that the strongest arguments, it's that this is an issue of personal choice. So it's more about diet and exercise. And the others are quite similar, but the nanny state argument or the fact that the government just wants more money and that there are corruption issues to be addressed first are also relevant. So we'll hear from Marilia and Daniela and see which of these arguments were more relevant and how they managed to respond to those from a communication perspective. Thank you.
Okay, thank you, Juan, for the introduction. Hello, everyone. Thanks, Guy, for the invitation for this webinar. Just a minute, I share my screen. Is it working? Okay. So, In the beginning, I think it's very important to introduce and bring your discussions about our current context in Brazil. On the one side, you have strong evidence to support our policies in Brazil. For example, you have around 40 million people, obese adults in Brazil. It's around 100 million adults are overweight. For diabetes, the situation is not different. Around 70 million people in Brazil living with diabetes. Yet, it's very important to address that the correlation among obesity and diabetes with the COVID-19 is very clear, it's very strong. For the children, situation is not easy. 1 in 3 children are overweight. And of course, the consequence of the health costs is so high. And I bring here just few numbers because you have more evidence about that, about to show the impact of the health and costs, because the diseases related to obesity, diabetes, and consumption of SSB drinks. For example, the obesity, you have announced around $6 billion. Diabetes, around $2 billion. It's the last figure here, around $66 million, around it's related, all diseases relate SSB consumptions. The figures are very high. But the other side, you have a strong beverage industry in Brazil. Brazilian consumes a lot of amount of the liters of the sugar drinks. And the operation Brazil, for example, for Coca-Cola is one of the most profitable in the world. And part of the profitability is due to this high amount of subsidies that the government give this kind of industry. It's around 3 million reais, around $6 billion, depending on the current change. Is the correlation between influence and power is very strong. For example, we have an important senator in Brazil is the second bottler of Coca-Cola. And you have noticed high interference of the Beverage Association in all discussions when talking about fiscal policies in Brazil. It's our context at the moment. So what's the goal, the policy goal? Of course, the long-term goal is to reduce the consumption of the SSB consumption through fiscal policy. But in Brazil, you have to combine 2 strategic roads. You have to increase the price is necessary to create a specific tax and to work to reduce or eliminate the subsidies. It's the reflection this 2 strategic roles in our advocacy work. Então, we have to defend the reduction, elimination of subsidies, and proposal SSB taxation. In the moment, because in the last year, the discussions about the fiscal reform has started and has warmed in Brazil, and you have opportunity to work and address these issues together the fiscal policy. In the moment, the scenario to discuss the fiscal reform in Brazil, because everybody knows the advancement of the pandemic in Brazil, it's the terrible situation, as it's not a clear perspective to progress of the fiscal reform discussions. But of course, it's not point of our presentation here, but to clarify, because you have discussions, we have different scenarios to work to propose SB taxation independently of the fiscal reform. So, but it's very addressed because part of the work is increase awareness of the SSB is unhealthy product like tobacco and alcohol. It's important to communicate the rationality, effectiveness of this measure to reduce consumption, to spread and share the international experience. You have to communicate this. There is a false dilemma in between economic and health, because if you apply this measure, you can find positive economic impacts in Brazil. Of course, subsidies is not logical, and it's opportunity to have resources for health, mainly in this time of the pandemic. So what the population think about this complicated issue about tax in Brazil? It's a very complex, the Brazilian structure. There are many taxes involved. Okay, you have carried out some public polls along the last 4 years to ask the people, to ask the population, what's your support about the creation of SSB tax, subsidies, of the price has an important factor to decision purchase for SSB. And the result is very interesting. You can see the years, you can see the figures, you can move now you have an increase of the perception to support a creation a new tax. Of course, they're against the subsidies. It's not logical, and it's in the confirm the price. It's a very important factor for decision of purchase. Now it's the population in here. What the policymakers thinking about this issue is the survey. It's very recent. We applying in February around 108 parliamentaries, and you about specific to discuss this taxations, the unhealth projects in the context of the fiscal reform. And the result is very interesting because confirm our perception. It's interesting because around 70% of the parliamentaries are willing to consider a specific tax for health products in the text of their fiscal reform, and around 66% to really to prohibit subsidies for health products. Of course, it's not sense, but which products? It's interesting because confirm our perception, tobacco and alcohol has a higher percentage about the results, but the soda, the other sweetened beverage, it's the figure confirmed our perception. It's for the reason part of the work, it's convincing that the kind of the products it's so unhealthy that's necessary intervention of the state to reduce the consumption. This slide just to present to you because we have an overall strategy to pursue our goals. Né? In the case evidence, in the last year, you have finalized important studies because one of them I presented in the next slides. You hire an important institute in Brazil responsible for economic metrics, FIPE, and together we finalize a study to measure the impacts on the economics and the consumptions of the SSB categories in different scenarios of taxation. Now we have received another study about the health costs related just to exclusive SSB consumptions. And for the reason we developed a website, I present to you. Danielle, you bring main ideas about the mass media campaigns and the another mobilizations. And the formal mobilization I would like to highlight because here is last year we have an opportunity to bring for our side the former Brazilian Central Bank President Arminio Fraga. It's not convincing about the SSB taxation as a public policy to reduce the consumption, and now it's in our side to defend this measure. It's a big advance in the last year. And of course, you have several initiatives for our work for political incidence with the main actors, Ministers of Economy and Health, parliamentarians, and the other actors important. So it's now I would like to present, I ask here and go to the website. So it's the website, the name is evidence about health taxes .org.br. What's the main idea to create a website? Because we have many informations about tax. It's the evidence are not put in the same place. Another thing, the taxation is not easy to understand. And there are many evidences in English and Spanish, but not in Portuguese. Now you have in the same place, of course, the website is under evolution. You put more information. You have several informations in Portuguese and the consider the Brazilian context. And use here in the website the many possibilities for the communication. In the main screen, you have a video that you many evidence about taxation. I cannot play the video here because the time, but I can share there the video, the subtitles in English. You have a lot of use the infographics to communicate here. Also, you can find, for example, the report in the full version and summary version, infographic static. But because the time, I would like to present our simulator. The simulator is part of our study we developed at FIP to measure the impacts of the economics and the consumption with different taxation scenarios. We choose in this study to apply a tax for SASB beverage. For example, here considering not only the sugary drinks, but sugar and artificially sweetened beverage, because it's a possibility in the formulations in Brazil, the progress. You have a study that involve this category. But of course, in a discussion of the policymakers, you can choose the category more important. So what's the best part of the simulation? It's the good tool for advocacy efforts. At the moment, you have more the data of more this tool, and we have a meetings with parliamentaries, policymakers. For example, I put here, it's not a good translation, but I think it's could be okay, useful for this presentation. Here, the user can choose the tax rate applied on the products. For example, you start here, 20% is a recommendation of WHO. See, you can see here the drop of the consumption of the all categories together. You can see individually, okay, soft drinks, sorry for the translation, but a kid diet soda, kid dairy drinks, isotonics, and one. You can see the drop of the consumption, not only for Brazil, but split of the 5 main regions in Brazil. You can see also the increase, the consumption of the another categories. You can see increase of the wall, you can see the water, milk, coffee and tea, natural juice. And you can see the level of the revenue you can collect with the new tax. It's very important because see here in the graphic, you can see the maximum point to achieve the figure. Here is around here, around 7 billion reais. But in the economy, yes, to answer the main questions about the industry, yes, you have a positive increase of the GDP. Okay, and here in the simulation, you have two options. If you use the revenue just for maintain the standard of the government, I have a figure, but if you use the amount of the revenue for dedicate for public health, you have an increase of the GDP more. You can see the same rationale. You can see the all number and the split of the regions in Brazil. And it's happens the next way. What's about the jobs positions? Yes, in the prove here that at the increase, the new jobs are created about the taxation. Of course, it's a movement in the economy. It's of course the industry probably reduce the vacancies, but increase in other sectors. In the same way, you can see the overall figures for Brazil and split for the region. And here you can see the most benefit sectors for with taxation. So it's a quick view about the simulation, but you have learned that it's very useful. You have an opportunity to present the results for the special advisor of the Minister of Economy. It's very interactive, and you have a possibility to use tools and discussions. Yet I return my presentation here because now Daniela continues the presentation.
Hi, everyone. Thank you, Marília. So let's talk about our communication efforts, and I will present our MMC campaign. We have the first phase of our taxation campaign last year, from August to October, and now we are just developing the pieces for the second phase that should be launched in May. So this first phase, where we have this as a slogan, sweet and sugary beverage, if it's bad for your health, it must have higher taxes. Sweetened and sugary drinks consumption is related to obesity, diabetes, heart disease. That's why we must raise the tax of these products. It's good for the health and for the economy. Next. The campaign goal is to raise awareness about damage to health due to soda consumption and show tax as one of the ways to tackle this problem and reduce prevalence disease. To mobilize population and opinion leaders to support and press decision makers on the discussion of SSB tax at the fiscal reform at the Congress. Next. Our audience, the primary is the decision makers and policy makers as ministers of economy, revenue, health, deputies and senators at the National Congress. And our secondary audiences are opinion leaders as doctors, mothers and fathers, journalists, economists, health professionals, and medical associations, from AB class, Rio de Janeiro, São Paulo, and Brasilia, where they are most concentrated in Brazil. Connect. We are going to show the video of the masterpiece of the campaign that we have the video blind test 30 seconds. Can you show that, please, Marília? Marília is gently passing the slides for me. We have that with subtitles in Spanish and English, and then we can send the link to share in our email group. The sound is not, are you here? I think it's without sound, Marília.
Sorry, Daniela, it's not working.
No, I think the sound is not working, but we can jump this if it's not a problem. Then we send the link for the participants in the chat, at the chat.
Okay. I'll continue
here.
We can just saw the subtitles, okay?
Okay.
How's the time?
Okay. But the video brings the testimonial of a victim of diabetes, talking about the consumption of, but then we can send the link for you. I think we can go back to the presentation. Yeah, and just in the other slide, we're just the slide before, we are just showing that we have as call to action an online petition that send letters for the policymakers. And about building the narratives, our narratives are based on the results of message tests during focus group that we made on the first phase of the campaign. And one of points of the results says that real people testimonials focus on showing disease related to soda consumption, sensitize and engage on the campaign. And another result that we have from Texas group that people think that taxation doesn't work, but they would be more likely to support if revenues from taxes were used for health. So this point we are reinforcing this message in the second phase of the campaign that's under construction. And we have a very important thermometer to build our narratives. the social media campaign on the MMC, because we have the opportunity to test different kinds of messages and analyze the reach and the directions, such as these are some examples of message that most works and give lots of a big reach. One is to show image of soda and the amount of sugar in it, because it calls attention of people as Coca-Cola is the top of mind on Brazilian population. People stop to look at an ad when they see about a soda can and the amount of sugar. We also have been using evidence-based, showing the impact of health and economy, about the taxation. We have been showing successful experience on taxation, ask questions to promote the debate, and leverage media hooks. That's news from the moment to taking a ride on those news, and use commemorative days as World Diabetes and Health Nutrition Day. And I will show you some examples in the next slides. Next, please. Yes, as we know, the campaigners in this group should know that talking about taxation is a very controversial and polemic subject. But for the other hand, it's very good to have the algorithms of the social media to deliver more the posts for to our audience. So we have a total of 16 posts in 2 months. We have 1 post per week, and Facebook, Instagram, Twitter from ACT webpage profile, and also Alliance from Adequate and Healthy Diet page. And this in red, you can see the percentile of negative comments, and the blue one is the positive comments, and the gray one, the neutral ones. This then will show the prevalence, but still the negative comments are bigger because it's controversial, as I said, but then we'll have to work a lot to counter arguments when people start to talk in those posts. Next, please. So we will pass some of these posts that we have most successful in reach and interaction in our social media campaign. So we are, when we show the evidence base about the health disease directly related to soda consumption, it's very good to make the awareness among population. Next, please. We show it, and this was very interesting, the successful case on taxation as tobacco and Mexico case. So it says when tobacco raised taxes, the consumption decreased. The other is, do you know what Mexico did to reduce soda consumption? Raised taxes. And then we explain on the subtitles of the posts, the link among the campaign and how does having taxation increase, you can have the reduce the prevalence of the disease, and then pointing to the sign the petition. Next, please. This is very useful to ask questions on the post because this promotes a very huge debate. Just to have an idea, this third post that talk about the prices of the rice that has been higher 3 times in the last years in Brazil, we had for about more than 600 comments in just 1 post. So it's very good for the interaction in the social media. And we have other this kind of generate curiosity questions so that people can interact more on the posts. Next, please. And we have those posts that's very useful. It's a kind of a take a ride on the news of the moment that I have talked before. So for example, this first one, it was when the Brazilian dietary guidelines were under attack of big food lobby. So we just talked about this to say about the ultra-processed food and the damage for the health about the soda consumption. We have these 2 posts now, the rice, about the prices of the rice, and this other one is about books. It's still in debate in Brazil that government wants to raise taxes of the book. So we used the call in this post is that we don't need more taxes for the books, but to the sugar and beverage, yes. And this other one is about the Health Nutrition Day, for example. Next one, please. And other opportunities is about the World Diabetes Day. What do we want on World Diabetes Day? Public policy that help disease prevention. And these other ones, another discussion in Brazil about the government wants to reduce tax of guns. This is an absurd, but then we go and use that for what products should have less taxes, guns and soda or healthy products. And all of those posts generate a very, very big debate because it can, next please, Marília. Because it's very important to show how does our audience reacts to the message and how to counter arguments we should use to change their opinion and ask to sign the petition. So in social media, we have 40% of negative comments against 25% of the positive ones. And the most negative comments we have was about the nanny state, that government should not interfere on individual choices. It's the consumer's fault. We are red pay too much taxes, and more taxes means more corruption. And why not reduce tax on health products? Next. And these are other arguments as negative ones, but it's very good learn for us for shape our counter arguments. And the tip that I give that we should have a community manager person specifically dedicated to answer and to counterattack these arguments of negative ones, because we cannot do this in our day-by-day work on a communication team. So it's very important to have a content person just talking with them, changing ideas, and then asking them to sign the petition. And we produce a very completely FAQ Q&A answers to help this community managers to answer those questions. Next, please. And the second phase, I mean, just close to the end of the presentation, we have the layout at the semi-visual identity of the first phase, but we're using the relevance to use as relevant to highlight taxation as good for economy and can generate resource for the health. That was a lesson learned from the focus groups. And also to show the new evidences that Marília talked, because those evidence was launched by the end of the last year. So we are gonna have the opportunity in this next phase of the campaign to highlight those evidence about economic impacts by the IEX study and the FIP study. Next, please. And these are the two KV, the key concepts that are going to be tested in the next days. The both shows the image, one highlight the image of the soda can with the amount of the sugar, and the other is the lesson learner for the focus group to show the victim talking about the numbers of disease caused by diabetes, by soda consumption, specifically about diabetes. So we have just two pieces that are being tested, but we asked the Asians for this campaign to have a specific piece talking about the economy, just about the economic impacts. Because yes, Ron, I'm just finished. You want to remember me that I have my time over. And we have this piece just to talk about the economic impacts that will be used, focus on decision makers and the policy makers. The next one, please. And then we can pass, Marília. I won't have time to talk about this, but then I will send to you these very interesting opportunities of experience we have in below the line activities to call attention about the taxation and to engage people to sign the petition. So one is the happiness stand and the other one is our soda machine, just to show the image, but then we tell you everything in our email group. And that's it. Thank you very much. Sorry for the overpass the time.
Thank you, Dani and Marilia. Thank you very much. We hopefully will be able to address questions by the end of the webinar, and if there are other comments, we can follow up through email. Thank you. Next, we will hear from Nicole Foster, a policy advisor at the Healthy Caribbean Coalition, who will be talking about legal issues related to SSB taxes in the Caribbean. Nicole is a former international trade diplomat with expertise in international law, international trade, and international organizations. As policy advisor, Nicole provides legal advice and comments on the different products the Healthy Caribbean Coalition is engaged with. She is Deputy Dean at the Faculty of Law of the University of West Indies in Barbados. Thanks for joining, Nicole.
Thanks for having me, Juan. It's my pleasure. So yes, I'm going to talk a little bit about the SSB taxation in the Caribbean. Next slide, please. So before, much like the other presenters did, I just wanted to set a context for why it is that SSB is very relevant in a Caribbean context. And basically, based on all the data we have, particularly that coming out of PAHO, the Caribbean actually has the highest NCD-related burden in the Americas. And unfortunately, our figures aren't going down. And so you see here, this is a slide from a PAHO workshop. We have 78% of our deaths being linked back to NCD-related causes. Next slide. And similarly, you see the same trends. And so the trends aren't, the trends are going in the wrong direction, unfortunately, in the context of the Americas generally and the Caribbean in particular. So we maintain the highest premature NCD mortality in the Americas. Next slide. And then if I zero in just on Barbados, so of course the Commonwealth Caribbean, there are, a number of territories there, 15 to 20, depending on how you're counting it up. If you're just looking at CARICOM or the wider Commonwealth in the context of some of the overseas territories. But if we just zoom in on Barbados, and in this regard, Barbados is quite representative of the rest of the region. So 8 out of 10 deaths in Barbados are caused by NCDs. 1 in 3 children in Barbados is overweight or obese. I know that's very similar to what happens in Brazil. 1 in 5 adult Barbadians has diabetes. 66% of adults are overweight, 33% obese. And the prevalence of obesity is quite high, particularly among women. Next slide. And then just to zoom in specifically on the question of SSB. So when we first started discussions about SSB taxation in Barbados, one of the pushbacks or genuine questions in some instances was, well, if you've identified that unhealthy diet generally is a problem, why is it that you're just making the sugar sweetened beverages the bad guy? Yeah, why don't you try to address everything? And we said, of course, we're going to address everything, but we have to start somewhere first. And we feel that SSB taxation or the SSBs is a useful point to start. Why? Because the data, and this is from the Global Dietary Database, you can see comparatively what how much SSBs account for in our diet. So in Barbados, we have a significant proportion of the population that consumes SSB drinks. And as we said, in terms of our dietary profile, it really is astounding, the difference between the global average and then the average in Barbados. And so we thought very much that the data was saying to us, if it was somewhere to start, really we needed to start with the SSB taxation, while recognizing that there are other aspects to the unhealthy diet that will be contributing to our obesity problem. Next slide. And so we have in the context of the so unlike, generally speaking, we've tended to find that in the Caribbean, we're a little bit behind in the comparatively speaking, in terms of Latin America, in terms of much of the policies in this area of unhealthy diets broadly. And SSB taxation is no exception in that regard. So we really only have, so if we look at CARICOM, which is the regional grouping in the Caribbean, which has 15 member states, we only have 2 of those member states that have implemented SSB taxes. Barbados was the first to go. We implemented a tax on August 2015. It's a 10% excise tax on locally and imported sweetened beverages. We chose to go the route of designating the products that are covered by our tax based on the tariff headings. So, you know, the tariff headings that are used in the context of in a trade context in terms of duties, etc. We use those same tariff headings to characterize which products were captured or not. And so basically what we have is that it does cover beverages such as juices, energy drinks, sodas, but it doesn't apply to beverages with intrinsic sugars, such as coconut water, 100% natural fruit juice, and etc. The details of the tax are set out pursuant to our excise tax regulation. So the main piece of legislation is the Excise Tax Act, which gives government the authority to act in this area broadly in terms of taxation and the imposition of excise taxes. And then regulation would have been passed specifically speaking to the SSB tax. It's important to note in this regard that the revenue that is generated from not the next slide yet, but that the revenue that is generated, if we could go back to the previous slide, please. The revenue that is generated from the SSB tax is not earmarked. So it is just, it goes into what is called the consolidated fund and is therefore at the government's disposal for use in whatever way it deems fit. And that's really been a stumbling block, one that seems very difficult, if not impossible to overcome in terms of getting government to agree to earmark any of the funds that are generated. And there were, from, you know, sort of anecdotal reports, significant funds that were generated from it. The other territory that implemented the SSB tax was Dominica, and Dominica introduced its tax just after the month after Barbados in September 2015, and that was also a 10% excise tax. So it's interesting to note that in both regards, we've had a relatively low, even as we move towards imposing the SSB taxation, our governments, for whatever reason, didn't feel comfortable imposing a level of tax at the sort of, at that time, recommended minimum of 20%. Interestingly, in Dominica as well, the tax was imposed on drinks and food with high sugar content. Also, Barbados was just beverages. Dominica captured products like candy, chocolate bars, etc. The revenues, like Barbados, go into the consolidated fund, but the government did give the commitment that some of the funds would be directed towards their national Get Healthy campaign. But of course, I mean, we don't necessarily have any documentation of that and how that actually works out, but certainly that was the commitment that was given. Next slide. Right, and just quickly, this is just a slide about the results of the tax. I just refer you to this study by Alvarado. We've only had a study thus far in terms of the Barbados tax, and what we have seen is that there has been, even at the 10%, there has been some impact on some small decrease in consumption of SSBs, but we also saw there was some evidence of persons moving to lower cost SSBs, not necessarily transitioning out into just non-SSB drinks altogether. And also we had a sense that the evidence suggested that at least some of the producers were absorbing the difference in price, because at 10%, it was a cost that was in their interest to just keep that price at that level, and they could continue to have their sales in terms of volume. Next slide. So looking specifically now at the question of the law and legal strategies that address the question of potential challenges to SSB taxation, I think it is important to bear in mind that the culture of the particular region makes a big difference. And so, as I said, just generally, we have tended to find that even both at the level of policy formulation, but also too in terms of litigation, we've not had the level of activity that we would have seen in Latin America and Latin America. It just seems to be culturally and socially, there's a different orientation in terms of the legal system. And so, and the culture that surrounds that. And so in the Commonwealth Caribbean, we are primarily a common law system. So as former British colonies, we have primarily a common law system, and our form of government is just either bicameral or unicameral. So we have a House of Assembly and a Senate, or just a House of Assembly, as the case may be. And we don't have these separations in terms of federal and local, et cetera, for the most part. Guyana and St. Lucia, of course, are a little special. They, because of their historical background, have what is called a hybrid system, and Suriname and Haiti have, of course, civil law regimes. But principally, when you're dealing with the Caribbean, you're dealing with a common law system. And important here, so really, if we're thinking about legal challenges, perhaps the most obvious one is in the context of the Constitution, right? So the extent to which industry or other opponents of the tax might say, well, you are violating my rights somehow in the context of this regulation. And in that regard, the tool that they would be using would, of course, be the Constitution. And we all have written constitutions with bills of rights. And it's been established long ago, since 1975, Antigua Times case, that to the extent that it is possible that corporations do enjoy rights under the Bill of Rights. So obviously a corporation can't have a right to life, but or not to be imprisoned, but you know, certainly in terms of particularly the right to property and the right to equal protection before the law, those would be rights that would potentially give the scope for some sort of a challenge. But the caveat that I add here is that, of course, not surprisingly, as with most constitutions, the rights that are stated in our respective constitutions are not absolute. They're all subject to a limitation in relation to issues such as public health, public order, national security, etc. And so it means that even as you might say, well, could industry make an argument about this? It is important to recognize that there are some safeguards there in terms of striking that balance between the interests of the individual, in this case industry, and the interests of the society as a whole. And in particular, you would want to be emphasizing the fact that these limitations are reasonably required and proportionate in the public health, in the public's interest. And I just mentioned these two cases here give you some insight into the approach to constitutional interpretation. So the courts, first thing, we have a presumption of constitutionality. And while it is true that over time, so we've been very conservative initially in terms of our reading of the Bill of Rights, and very limited in our reading of the Bill of Rights. That has tended to change over time, and particularly with the establishment of the Caribbean Court of Justice, which has tended to reflect on and try to integrate as far as possible international human rights perspectives into their interpretation of the respective constitutions. But at the end of the day, it still isn't a sense that those rights are absolute. So the court is still very much saying, and this more recent case from Barbados of 2019 is not a health case, but it emphasizes that in terms of saying there's this balance between how the courts have to address the question of interpretation. Even as persons have rights, those rights are constrained by broader public interest. Next slide. And so basically and certainly in the context of the Caribbean thus far, as I said, we've had no challenges. First thing, we only have the 2 countries with the taxes. We don't have a culture and a society that's very litigious. So we don't tend to, our first option to be to try to challenge in that context. What I would say we would tend to find more so in the Caribbean is that there's a lot of political influence. And it kind of goes back to the point that the Brazilian presenters were making in terms of the influence of the private sector, in terms of access to government and being able to influence policies and maybe convince you not to go ahead with the tax or to put it at a particular level. But they wouldn't necessarily go as a first route to litigation. But I would submit that there's in fact limited scope to challenge the constitutionality of SSB taxation in the Commonwealth Caribbean. That notwithstanding, we should of course prepare ourselves to engage industry should those types of challenges arise, because we know they tend to mirror the arguments. I'm always struck by, no matter which region we're dealing with, the arguments are always the same. And really there, what we want to focus on, as I said, is the question of the reasonableness of the measure and its proportionality. And to my mind, what will be key is the scientific evidence, of which we're getting more and more every day, that speaks to the SSB taxation being effective. And just in terms of any procedural, so for example, in Barbados, we had a challenge where...
I'm sorry, can you please...
I have to stop? Okay, so
yes,
just in terms of challenges, as I said, that's the focus, and really it's really more a fight about political influence. Over.
Thank you very much, Nicole. I'm sorry to interrupt.
No, that's fine. One more point more, that's not a big deal.
Thank you. Thank you very much. So we will now hear from Javier Zúñiga from El Poder del Consumidor. He'll be speaking about the different constitutional challenges that were brought against the SSB taxes in Mexico. He's a CIDES alumni with LLM in Global Health Law from Georgetown Law University, and with extensive experience in human rights and NCD legal issues. So Javi, please go ahead.
Thank you so much, Juan, and thank you, everybody. Thank you for the invitation. So, as Juan was saying, I'm going to share with you some of the main arguments that were claimed before the courts in the Mexican case, but also I would like to make an overview of the general challenges that will accompany this legal challenge. So, in order to do that, first I'm going to share with you briefly the context of the discussion. Then I will the previous one, just for a few seconds, please, the previous slide. And then I will talk about how it works, the tax. And afterwards, I'm going to talk about the media campaigns and how these accompany the legal challenges. And finally, the main arguments of the courts. Thank you so much. The next one, please, the next slide. So I'm going to give you just 3 facts just to put you in context of where we're in the discussion. At that moment, Mexico was the 2nd country with most people living with obesity throughout the world. Then the estimations of the data was that 1 of 3 children was in risk to develop diabetes and other chronic diseases. And finally, in 2009, Mexico was the country with most people consuming sodas and sugar beverage. So this was the context at the moment of the discussion. The next slide, please. And this, so now I would like to explain briefly how the tax works, and it's extremely easy. This is a general overview. And in the case of sugar beverage, we have 1 peso per liter. So we have 2 liters, we have 2 pesos of tax. And then we have the solid ones, or the products that are solid, in which first we have to exclude non-basic products. That means rice, bean, and all these basic food. And if we have a product with a high density caloric, then we will have to add the 8% of the final price. This is the general rules of the taxes, and these general rules were challenged by the enterprises. The next slide, please. So another challenge that we face at the moment was that we have to create a public awareness of the problem, and we have to put this topic in the public agenda. So in order to do this, we identify different moments of the discussion. We have a campaign before the approval of the proposal, and then afterwards. So before the proposal was approved, we have to focus in how we can create this public awareness, and we focus in drinking fountains. We need these fountains in schools, we need these fountains in public gardens, etc. So that's why we need the money. Afterwards, after the proposal was approved, we changed slightly our discourse in order to focus in conflict of interest. We knew that the companies will pay evidence in order to prove that the taxes will not work. So it is important to identify these differences before and after any discussion of taxes. The next slide, please. So now coming into the legal area. So the taxes came into effect in January 2014. The discussions were at the end of the year of 2013, and after that, many companies and enterprises filed legal challenges against it. So we have an estimation that there were more than 100 cases throughout Mexico, and after a few years, at least 10 of these cases reached the Supreme Court. 7 were challenging the tax on beverage, and the other 3 were challenging the tax on the food. So what were the mandatory criteria that the court established after these cases? First, we have to look up on the plaintiffs. Who were the plaintiffs? Because at the end, we need to know how these companies works in order to hide the real identities. The next slide, please. So in most of the cases, we can see that big companies such as Coca-Cola, PepsiCo, and Walmart were the plaintiffs. However, this was more like how we can say, like a Halloween of companies, because they will use always a custom. They will not challenge the taxes as Coca-Cola company. They will use Jolly de Acapulco, for example, that is a bottling company, or Desde el Corazón del Fruto, that means from the heart of the fruit, that is another beverage company. So it's important to be aware that the companies will not use the real names or their famous international names, but they will use local enterprises names in order to challenge these policies. The following one, please. So in general, most of the cases were ruled against the companies. However, there were some few successful cases. The court stated that those companies who argue that the products have not been modified in their composition were not able to, they will not have to have an tax. The perfect example of these are peanuts or almonds, so good for peanuts and almonds. But the other cases, most of them were ruled against the companies. So despite these 3 exceptions, most of the legal challenges were denied by the companies. In these cases, the court reaffirmed the constitutionality of the tax and also reaffirmed its purpose. The purpose, or the main purpose, according to the court, of these taxes is to discourage the consumption of unhealthy foods. All of these cases set the precedent for future cases and created this concept that I think it's extremely important, that it's known in Mexico as extra taxes purpose. That means that the main purpose of these taxes is not to have a huge income for the state, for the government. Is actually to discourage people from consuming things that might be harmful for the environment or for their health. So in this context, we have we were wondering why the enterprises, why the companies challenge the tax and which were the main arguments. The first main arguments was more procedure. They challenge the power of the Congress to legislate about the taxes, and the court stated that the federal Congress has all the powers to regulate, establish taxes, including beverage and high caloric food taxes. The next slide, please. And just a brief summary of the arguments that the companies brought to the court. I would say that the first one was like, does the taxes violates consumers' rights? Does the taxes violates these taxes violates the general principle taxes that are in the Constitution? Those these taxes are compatible with freedom of trade, freedom of commerce, and is this tax a proportional measure? So the court in all of the cases said no. Consumers' taxes do not violate consumer rights. Actually, it encourages them, it supports them, because with the tax, consumers can easily identify products that are that are unhealthy, or that they need to be discouraged their consumption. Regarding free trade arguments, the court stated that these taxes do not violate the freedom of trade because it doesn't affect the competition and it doesn't affect the, the, the main core of the right. The enterprises and the companies can continue selling their products. Now they have to pay a tax because of a context of public health in Mexico. There was people living with obesity and overweight. Also, the court stated that the taxes followed the general principle of taxes that are in the Constitution, such as the due process or the tax equity. And finally, the court also stated that the taxes was a proportional measure. That means that in order to respond to this alert and alarming situation in context of public health in Mexico, the legislation, the Congress stated a tax to discourage the consumption of these products that was one of the causes of the problem. So in this context, the court analyzed that it's fair enough to pay an evidence-based tax in order to proportionate some public health measures to address this problem. So these were the main arguments that will file in the courts. In the courts, I think that in any case, not only in Mexico but in the region or throughout the world, there will be arguments that will be replied. We can see this how the companies interact in other places. So they are always using the same arguments over and over again. So so I think it's important to just to outline the main ideas that the companies presented before the courts. And the next slide, please. I think is the last one. Yes, and just quick brief conclusions. First, I think it's important in our experience to accompany all the process, the discussion process, and the legal challenges with a media campaign. I think as advocates of public health, we need to create this public awareness and also to translate not only the technical issues, but also the legal challenges to the public in order to win the public discussion. Also, as I was saying before, the legal arguments, it will be mostly and likely the same in all of the cases. Most of the companies behave in the same way before the courts, outside of the courts. So it's important to identify and outline these main arguments, so we can have a counteract or some other counter arguments against them. And finally, one of the most important things is to have the evidence. I think that in all the process, in the discussion, in the legal challenges, the courts, the scientific evidence and the voice of the experts is one of the most important things to use. And in general, this will be the challenges and the general recommendations that we experience here in Mexico. So thank you so much for your time, and please feel free, everybody, to ask us for the argument, for the cases, and any other material. Thank you so much.
Thank you very much, Javi. So we ran over the expected time, but and we have been responding, panelists have been responding to a few questions and comments directly in the chat. Unfortunately, I don't think there's time now for more questions at this moment. I just wanted to mention that in the case of Mexico, actually there were more than 100 challenges against the SSB tax. So there's a good amount of cases from which we can build in that country. We learned in the previous presentation from Nicole some of the arguments that are also relevant and useful for the Caribbean. And we heard in the first presentation how they managed to present this technical issue in a way that it's appealing to a wider audience. So I think there are interesting lessons from our panelists. Thank you to them. We are open for questions and comments through email, and we'll make sure to share that with panelists and follow up with participants. We will be sending the recording of the webinar and additional material to all the registrants in the next following days. Thank you to the panelists, and thank you all for the participants of the webinar. Hoping to see you soon. Goodbye. Thanks.
Bye, everyone. Thank you. Bye.
Bye. Thank you so much.
Bye.